thank you all for having me. It's been a pleasure. Some of you I met already yesterday, and then the question came up, what are you doing at DDL? And if you heard the introduction from Yorick, I'm actually right now overseeing the science in a startup doing personalized cancer vaccine. So no inhalation, no lung. But until beginning of this year, I was actually kind of leading the scientific team in a startup working on respiratory infections. And when I was asked to join this session, I started to think about what it is for me, what does it take to make innovation happen? And then 5 things came to mind. And this is the timing, the team, your idea, the business model, and the funding. And I just want to kind of go over the story of GST antivirals and kind of tell you why I chose these 5 points. So GST antivirals was founded in 2019. So we're coming to the timing. If you see 2019, we're just at the start of the corona pandemic. So this was incredibly hard to set up a lab during the pandemic. But on the other hand, as you see, we have antivirals in the title. And that kind of made it so much easier because antiviral research was hot at that point. So what I want to say is that always there are these topics coming in waves, and I'm not a fan that you have to really follow them and kind of pressure your idea into it, but sometimes it just helps, especially in the beginning. The second point was the team. And I think this was my biggest learning curve, for sure. Coming from academia, being a postdoc, joining a startup, and then starting to hiring people, really, you have to learn it. So you have a very small team in the beginning. You have to choose very wisely. And I think also there is a certain mindset or culture to startups, and you have to find the people that fit to it. So that's why I think innovation is definitely driven by the team as well. Then let's skip the idea for now, but go to the business model. And I think here, if you're coming from academia, you want to bring your innovation to the patient in the end. And I think that's what everybody wants. You want to help patients in the end. But as a startup, I think you have to know your clients in a way, because this could be actually a bigger pharma partner after phase 2. So you have to also plan accordingly. And that's why I think the business model is also very important for innovation. And to kind of come to the funding, I think everyone knows money is important. And I think there are also very different ways of how you can approach funding. I can just say we were based in Austria. And there, the funding landscapes for startups is actually incredibly good. So you have the possibility to get some pre-seed funding to really just kick things off. And then you can apply for more and more funding along the way and loans that are actually coming from the public. So with this, I think here you can actually see that with, let's say, only 10 million, we actually handled a clinical phase 1 and 2, and this 10 million came from not only VC, but public and as well as industry funding. So again, funding is also driving innovation because, of course, you need it to actually proceed. Then, coming to the idea, we had the idea that we use 2-deoxyglucose, which is a glucose analog, to starve viruses within the cells, and by that actually kind of preventing and curing the common cold. And if you're in the common cold field, you know that is the holy grail. So we were always joking that go big or go home. And I think looking back at the time at GST antivirals, we actually really went big. As said, we had a clinical phase 2. So this is a picture, and I can not tell you how proud we were when we actually had the first volunteer into our phase 2. So this is a picture from the phase 2 unit in the Netherlands we worked with. But I think you always have to keep in mind how it all started, and that's how it looked for us. So that was the office floor, our clinical project manager and our CEO. I mean, there's no virus in the pipette, I guarantee. It's only saline. But of course, there's so many things that you don't think about before you bring your innovation to the clinic. So how do we deliver the virus there? So there's so many small innovation steps along the way. And this is, I think, something that is very important to know. Like, you will always be more innovative along the way. And I think I said we went big. Unfortunately, we also went home. Yeah, the biology didn't work the way we anticipated and had so many preclinical experiments done beforehand. And the phase 2 was not positive. So the company is not active any longer. But again, even though we kind of failed to bring the innovation to patients, I think we succeeded on so many levels along the way that I can just say I would do it 100% again. The team, we still meet regularly, even though now we're in different places. I think that's also an important point we maybe raised in the panel discussion. How do you maybe end something, especially if you know that it's kind of coming soon, the end. But then also, yeah, I don't know, like, I wouldn't do it different. So I would say to the 40% in this room who actually in the beginning said, yes, they're maybe thinking about it, definitely go for it. And to the other 60%, maybe now, after this session, you have the spark to actually drive some innovation. So thanks a lot for listening, and I'm looking forward to the panel discussion.